Welcome to the greatest innovation and digital transformation in health event to be held in Portugal. This initiative is to discuss the future and to discuss the present and anticipate the future. We all know it is essential to invest in technological innovation to improve healthcare. This last year, in which the country and the world were taken by surprise by COVID-19 pandemic, has accelerated digital transition. In the next hour, we will be talking about the role of professional associations. We have Miguel Guimarães, who is the head of the Doctors Association, Miguel Pavão from the Dentists, Mr. Sousa from the Nursing Association and coordinator of the information systems in nursing, Helena Farinha, from the Director General of the Farmacêuticos Association, Francisco Rodrigues from Psychologists, and Francisco Silva, Nutritionist Association. Welcome very much. Thank you for being with us to discuss these issues. And my first question is, how can professional associations contribute? How have they been contributing to accelerating digital transformation in healthcare? This is a question that everyone will answer, of course, and I will begin with you, Miguel Guimarães. Dr. Miguel Guimarães, what role do the professional associations have in this field? Thank you very much for your question. First of all, I'd like to greet all the participants and all the associations represented here. All the associations have played a role in digital transformation that is great. Granting more access to safety in the data, security in the data that they need for their activity. I'll give you the idea of the virtual situations that have taken place. Giving you an example of what we are doing right now that has to do with information. In addition to this, the Doctors Association has been trying to help with legislation to define the rules of the so-called remote healthcare, what we normally call telemedicine. I'm afraid that the sound isn't coming through in a clear way and it is impossible to translate.
To put in contact several types of doctors, public sector and private sector, specialized cares. There's a complex number of initiatives that the digital transformation can absorb, but they should all be regulated in all this process to be done safely. Thank you.
Thank you very much. I will now pass the floor to Miguel Pavão, the head of the Dentists Association. And the question is the same. How has the association played a fundamental role in this digital transformation? Thank you. I'd like to greet all my colleagues here in the panel, and I would like to reinforce that this eHealth Summit is to be congratulated. We've always collaborated in working group with SPNPS, with several groups that have a future outlook, and the future will head towards digital transformation. Absolutely. We at the Dentist Associations know the advantages with regard to the information system for dental healthcare. It was created in 2007 and was perhaps the first system of shared medical information, and it has been optimized. It is an exchange of databases and the exchange of information among patients, and it really makes things easier. I think that all the associations have a potential interest in literacy, digital literacy for healthcare professionals and the population at large. We, as healthcare promoters, and we're used to literacy in healthcare, want to know more about digital healthcare literacy. Dr. Miguel Guimarães has said that there are the multiple ways. We have a new world ahead of us. We know about the cross-border challenges, the mobility among the healthcare professionals, and we dentists have many colleagues and dental healthcare professionals in Europe and the world in sharing data. Essentially, it's been very, very useful for us, but also the mobility of citizens that can, in different European spaces, access the same data, the same medical records that have been set to the same parameter in different countries. What matters for dentistry at the moment is to evolve towards the private sector in terms of digital transformation. Digital healthcare in the private sector, which are still very much focused at the moment in the public healthcare service. Nurse Hélder Sousa, what has been the role of the Association of Nurses and the importance of digital transformation that is inevitable in healthcare? Good afternoon. I'd like to greet everyone in attendance. The Nurses Association has a background of using IT and a series of data that are produced and processed that dates back 30 years. Since the 90s, nurses have been focusing on IT. And proof of that is that the Nurses Association has a structure just for IT and information systems. So we have this vast interest in the subject and the importance that nurses give to these subjects. And I'd like to say that the Nurses Association has, for many years now, had the mission of being able to code all the interventions, all the diagnoses, and all the outcomes of the interventions by nurses to the benefit of the population. Above all, we need to understand that the associations are there to protect citizens' interests, to protect those who are given health care. We always focus on the citizens' interests. When associations are able to regulate the activities of all its members, and this is also regulated according to the information systems and IT, only then will we be able to have the guarantee that we offer the best care to the citizen, because it is regulated in terms of information systems also. We had an amazing example last year with COVID. It showed that all the technological innovation can help in fighting disease and promoting health. This is something we'd been fueling over time in a less expedite manner. All of the proposals put forward for innovation were slowed, so to speak, and then all of a sudden we were able to figure out that there are things we can do very quickly. I'm giving you an example of, say, the 13 COVID platform, which is to monitor the COVID cases, and this was built overnight almost, and it allowed a lot of this monitoring to be done effectively. But this is just one example. I may have the opportunity to give a few others of the importance of professional associations for information systems. Dr. Helena Farinha, the Pharmaceuticals Association, how have you done this digital transition? What are the steps that you've taken? Good afternoon, everyone. I'd like to greet the panel speakers and say that our association acknowledges the importance of these innovative resources. The digital transformation is something that we cannot overlook these days. For this response that we want, that is integrated and centered, we will need allies in terms of the digital transition. In addition to this benefit, we must say there are also some challenges, some have been already mentioned. Namely, the professionals' digital skills. And this has a very important role in terms of data protection, promoting literacy, promoting digital literacy, and our association has a fundamental role in accessing data by healthcare professionals in cybersecurity, in helping citizens. And we've collaborated with SNPS and several initiatives, not just for the pharmaceutical professionals, but also access to data literacy. We've worked with the steering committee. So there is a series of initiatives that we can foster, always based on data security and protection. Another aspect I'd like to note as a challenge has to do with the need of interoperation between the systems. This is very important, because it means that we have this transdisciplinarity to offer the best healthcare we can to our citizens. Another aspect that I'd like to boost here is that this digital transition has challenges that are not just local, they're global. For instance, the rights to cross-border care, or acknowledging the professions, or even forged documents. This is something that we cannot overlook, and we need to make the most of it to best serve the citizens, always maintaining the criteria of quality, security, and protection. Thank you very much. Dr. Francisco Rodrigues from the Psychologists Association. This was an intense year, almost a baptism of fire for the associations to see technology as an ally. Good afternoon and hello to everyone here. I'd like to thank you for inviting me to be here. I'd like to say that yes, it was a huge challenge. And I feel that if the associations weren't prepared and if they hadn't invested to be able to respond in the way they did, maintaining their services uninterrupted, for instance, maintaining proximity services in the context that we're still living through, and even more so, in many cases, always trying to streamline their processes. Well, it would have been very different had we not done all this. The healthcare professionals benefited certainly from the organizational capacity of the professional associations in terms of their technological readiness to respond. This was obvious, at least for the professionals it was very evident, but it also had benefits for the people who benefit from the services. For this, the associations had to build their capacities. First of all, guarantee their own security, because this was a context where some associations felt more hacks. Cybersecurity gained even more importance here. At the Psychologists Association, one of the things we've been developing most is training by everyone, including behavioral training and having drills. For example, a phishing hack, so that we can build capacities in people, make them ready. And we also focused on what the studies have been showing, which are the behavioral dimensions. Those are the ones that most jeopardize security at a technological level also. Then, once the organization is ready with these services operating remotely, and this was something that was possible because there was a lot of prior work. If all the work had been done from the need that the pandemic brought in, the results would have been different. We feel that at this moment, we are in a context that favors not forgetting the skills for this digital transition. Understanding also that not everyone has the same skills for this development. And this development of skills needs to be facilitated by having facilitating skills like removing some of the stigma associated with technology and the use of technology. That is just an example. And for this, there is an important role in the case of the professionals that are present. They have an important role here. Speaking about the population, we've had partnerships with the shared services like the other order associations here to develop technologies. We participated in S-Clinic. That is one of the most known examples for healthcare professionals. And we obviously benefit from the exchange of information that has been discussed here with regard to the status of the person who is being monitored in the health services and the, obviously depending on what can be shared. There is an aspect here, and I'd like to give you some food for thought, that there is a need to humanize the interface, the person's interface with technology, and to include what we know about mental processes, perception, cognitive aspects, motivational aspects when using technology, and a humanization of the impacts that using technology, and this is something that has been discussed publicly because of working from home and whatnot, the impact that technology has on people's health. So I would like to leave here this food for thought, contributions about technical and scientific aspects that cannot be overlooked in the digital transition. And the associations, each one with their specific know-how, have important contributions to be made in order to prevent some of these situations. Absolutely. Dr. Rui da Silva, Nutritionists Association, what have been the main challenges in this digital transition stage that was more intensive last year but has started earlier? Good afternoon. I'd like to greet my colleagues here. It's a pleasure to be here. I've been, when we compared to Andreas speaking that they work with data for 30 years, our association has only been around for 10. So obviously the context is different. To give you an idea, we have about 5,000 members. If we look at their age range, and I say 30 years, we have 42% of our members below 30 years. And if it's 35, 66% are below the age of 35. So what does this mean? This digital literacy in this age bracket, there aren't as many barriers by professionals. We found it easy in a situation like the one that happened. Obviously, there was some hindrance in terms of online consultations in nutrition. How do we assess a patient remotely? How do we measure them? But obviously this broke down the barriers, and our association right from the start, together with the shared services and the creation of S-Clinic, which is already set up. It began in 2013. We're still working on it. And now with the pandemic, we have the need to adjust this platform to having online consultations. There was a need for this, of course. And sometimes these catastrophes or these pandemics are a window of opportunity. And there are a series of care that we need, security issues. There's quite some challenges in terms of security from professionals and our patients too. The patients find that they lose a bit of this human connection. We need a lot of contact in nutrition. We measure our patients, but the association did try to do this, always support the questions that any professional had, and to support the shared services in this connection so that the systems would work with the purpose of remote care and not losing what we've had. At the beginning, people, at start, they didn't come as much, but then they felt the need. And why? Because our professionals made sure that this need was seen. A lot of them are prepared. They're younger. They have a different mindset to remove this alert in terms of technology, this alarm. There is still a lot of challenges arising, but I think we're on the right path. We are talking about the challenges of technology and this balance needed between the physical distancing and this reaching out that technology enables us to have. These are major challenges. Dr. Miguel Guimarães, how can the associations improve access to digital resources so that technology is increasingly at the service of professionals and working for them? You can hear me, right? Would you like me to ask you the same question again? Yes, we can hear you. Let me tell you something important here. First of all, we are one of the countries at international level the most uses IT systems. To give you an idea, in terms of medical prescriptions, we are top level internationally. In terms of the prescription and having it online. The effort that we've made over these years to use IT tools has allowed us to attain amazing results, especially when we compare to other countries, because there are others that could perhaps be more advanced in this field, like the United States, but they aren't because of issues like data protection. Something that Europe is now picking up on. That is the first aspect that I'd like to leave here. A second matter that I think is important is that all of the associations have cooperated in developing IT systems and the digital transformation of the system. But when we talk about digital transformation, I am thinking about innovation and the innovation it can bring to these processes. And something important was said by the head of the Association of Psychologists, and which we cannot overlook, which is digital transformation is important, yes. It will bring us closer to those who are further away and need us. Digital transformation can reduce some of the inequality in our country, although our country is quite small. Between those but we can have the inequalities in terms of those who live in major cities and those who don't, because of the type of specialist consultations that they may need or the type of chronic monitoring the patients need. But there is something that seems to me to be fundamental, which is how can we introduce this digital transformation maintaining the human and charitable characteristics that are so typical of healthcare professionals. The passion with which they see their occupation, being close to their patients. As Father Francisco was saying a few months ago, this is what we have. This is the last thing that remains. It has to do with relationships between people. That is the one thing that we have. It is important to speak about this, and I would like to reinforce what's been said. The paths that we should go on to place technology to our benefit, they're manifold. The first path has to do with literacy. We need to think about the two major foundations for a sustainable system: education and prevention. We have some powerful weapons at the moment that allow us to have digital literacy for people and to reach 10 million Portuguese people quite easily. There are tools for this. The Doctors Association about 2.5 years ago had an agreement signed with the Ministry of Health for digital literacy to arrive at 10 million Portuguese people, but obviously this required some investment, so it got lost along the way. But this was to give people skills, the information on prevention measures, diseases, and so on and so forth. And this is the time to do so. When we are now exiting a major pandemic where we all offered a very important contribution to help the country overcome this pandemic, where healthcare professionals were I wouldn't say heroes because I'm tired of the word hero, but they're the ones who sustained the country. They are the ones who headed some of the processes that allowed us to recover from possible wrongful political decisions. So we need to take stock of the situation. What do we have to invest in this field? I'd like to recall something important. Remote consultations with patients on the other side of the screen. At the moment, we do not have conditions in healthcare centers or hospitals to safely and securely and effectively meeting the rules of the so-called telemedicine to be able to do it safely and securely. What we've done often during this pandemic, and the representative of the Nurse Association spoke about trace COVID by doctors and nurses, but many times it was people's phones. We need to equip the National Health Service so we can have positive responses. We can avoid many patients who go to many consultations many times during the year. It's important for them to come, yes, but also having remote monitoring so they can come once because we need this relationship. But we can have own apps to interact with our patient, to understand what is going on and suggest in time, suggest what is necessary. And this type of circumstance implies heavy investment. Despite there being some investment in the digital side at several levels, we're talking about healthcare, obviously, but this is being done in many other fields like education, working from home, as has been spoken about here. But at this time, we need more investment. The shared services at the Ministry of Health have been doing a good job overall. They need to have more financial possibilities to take the next step to transform the relationship between the healthcare professional and his or her patient without those major screens. We need to have the doctor and the patient in front of them. This is possible. We don't need to be with our fingers constantly on the keyboard and looking at a screen. Of course, for young people, as was said by the representative of the Nutritionist Association, they find it easier. But truth be told, we can all, and we're all developing skills in this field. So this important aspect that has to do with the Ministry of Health and the bodies that depend on it, like the shared services, need to have more financial availability, more availability for collaboration. And the Ministry of Health, SNPS, and the various associations in the sector that are important, they all need to give their contributions so that we can ride through this digital transformation at this time. So we either do it now or we'll lose the momentum. Thank you very much, Dr. Miguel Guimarães. You spoke about a structural aspect that we need to study and develop so that technology is then effectively an ally. Dr. Miguel Pavão, what are the major challenges and how are they visible? How are these technological advances visible that are improving the work of healthcare professionals? I'd say that the advances are quite notorious. We dentists also have this generational advantage, but we need to address all the healthcare professionals. I wouldn't say that they are digitally excluded, but those who say they are. Dr. Guimarães and other people have said that we cannot dehumanize the healthcare with this technological transformation. And for this, I would say that this isn't a new challenge because these means the diagnosis and therapeutic systems brought this with them. When the final decision is only done with complementary systems, that is a mistake. We need to speak to the patient. We need to have a relationship with the patient. But the streamlining process has unblocked the human potential throughout all of the processes. And in this sense, I'd say that there's an important aspect here. When you go to a dentist, it is difficult to realize how we can have remote consultations. It's not just disruptive, it's simplifying without giving steps that are necessary in a technical consultation. And when you have a professional with a lot of instruments, a lot of equipment, but this comes as something complementary. You can have a monitoring when someone is far away. Dr. Miguel Guimarães spoke about the bureaucratic and legal dematerialization. And here there is, I think that there should be an articulation between the shared services and the legal scale. The law on radiological protection that is enforced for various healthcare areas almost contradicts the acquisition of equipment that will allow for digital workflows and almost cuts off this technological transformation. Anyone who invests in dentists, and they do so privately because you don't have lines of credit. If you have digital apparatus for this digital transformation, you then have a law that will inhibit any means of it being a facilitator. And that is very important to bear in mind. So at the same time, you have a mission to evolve towards digital transformation, but then at the same time, some laws limit and hinder this scale. I would also like to highlight another aspect that seems important in terms of dentistry. The pandemic brought some challenges, and internationally we see, for instance, Dubai, we have centralized databases between all dentists, and this helped research and teaching in a specific aspect to bring medical evidence on the relationship between periodontal health and the worsening of COVID-19. This was only possible because we could have the relation and correlation of data. If we didn't have that centralized information, we wouldn't have that productivity of results. Information is power. And I'd say that digitized and centralized information is more power. This is a challenge that is in our hands, that the associations cannot deny. It is a challenge that is on the table, but I would say that there has to be complementarity between the possibility of having support and the legal relations. And lastly, just to conclude, I'd like to give you the good example of the ADAPT program that helped clinics and healthcare providers privately and micro-sized companies to adapt their clinics for an adaptation due to the pandemic. And this technological adaptation could be done with investment given to healthcare professionals. It could be at a training level also. This will help the ecosystem to improve and lead it to be driven by lines and finance lines. That we need them. We need this entrepreneurial capability to know how to use these resources to heighten this transformation. So there's a long road ahead, and we need synergy and partnerships in this area. And also some of the recommendations issued by the association. Sometimes we talk about these alerts, the radiological law. For instance, we've always chasing what's already been done because the law's already been drafted. There wasn't prior work, and then we are always lagging behind. So these times are useful for us to work on the future and not just chase the decisions that have been taken. And from one debate, there will be important issues for further debate. Hélder Sousa, in terms of nursing, this humanization and direct contact with patients is an imperative. How has it been dealing with this digital transition without foregoing this? And how has technology been an ally? That is a fundamental aspect of our intervention. All of the healthcare occupations are practical, but some more than others, and some are more present. They are closer to the patients than others. Nurses are very close to the patients. Digital technologies tend to distance us from this role of being close. All technological innovation should be used to the benefit of healthcare professionals and patients. And how can we do this? The information systems need to be decision-making support systems and not just data repositories where the people are wasting time writing down what they've been doing, and then they can't withdraw anything useful from it in terms of their activity or responding to citizens. As the regulator for nurses, we feel that there's a path to be done in terms of improving the information systems that are at our disposal. We need to think that a lot of the information systems that are currently being used in the public service are 20 years old. They haven't been changed. Their architecture hasn't been changed, so they are not user-friendly. Once we realize that this is a hindrance on providing good care to citizens, we engaged in studies that led to something as important as what will happen for all occupations, not just healthcare, but all occupations, and we are proud to be at the forefront of this project. We have, in March this year, we presented the official version of the nursing ethics and deontology. It is basic, where all the concepts are interlinked here. And we are able to have all of them based on the best scientific evidence available to us. This means that the information systems use up less time than the professionals in terms of documenting their care, and the data that we insert in the system are then used to reformulate new diagnosis, and that way we can have reliable indicators that can be compared nationally or even at a European level. Because as a European Union prerogative, that means that we need to have this exchange. I'd like to also offer some contribution on information technologies that have helped us. We need to understand that once again, the Nurses Association has been pioneer in implementing several technological solutions. One of them is the the ledger of the healthcare professionals. We have more than 7,000 enrolled. This has been useful, and we can now see this with the issues of this platform and to need to register the vaccine. Without this register, which we've managed to achieve with the shared services of the Ministry of Health, we wouldn't be able to have this ledger in a useful manner, in real time almost, or in useful time, so that everyone can take part in this information, private or public entities. There are other examples that I'll be able to say later. We will now pass the floor to Dr. Helena Farinha for the Pharmaceuticals Association and to the Chemists Association. I'd like to know what are the most recent technological advances that are improving the services offered by professionals in terms of your association. Complementing what has been said before, and I will address your questions soon. There's a very important aspect here that Dr. Miguel said, which is digital literacy. Citizens need to know how to use these innovative systems. A watch can give loads of information. And on the other hand, the other aspect that has to do with managing and processing information. This is fundamental, not just when in person, but also in terms of research and generating information. Digital transformation needs to allow us to reach more people quicker in an efficient way, facilitating the processes and offering the capacity to manage information in an efficient way that will give us value generated to the citizen. In terms of technology, anything that allows us to access information so that our activity is as effective as possible and will contribute to greater care to the citizen. Before, you had to go to 21 different places, but now you can have access to that information in one place only. Another aspect that has been very relevant in this time that we have is obviously online consultations. We can communicate with the patient, which, as Dr. Guimarães said, we can have a hybrid system. There are parts that we cannot overlook. We cannot lose this human contact, but there are situations when it can be replaced by an online consultation. And at the start of the pandemic, we had phone consultations where we reached out to patients remotely, because it is important to know if the patient is taking their meds and the needs that they have. And this consultation over the phone means that citizens have what they need. In this aspect, it is fundamental For all of these gadgets and all of these tools for innovation may serve for healthcare professionals, each one under their own professional activity and competences can handle a world of information and thereby offer best care to the citizens. Thank you very much, Dr. Helena Farinha. Dr. Francisco Rodrigues, when we're talking about mental health, when we're talking about psychology and our emotional well-being, technology raises other issues, as you've pointed out. We don't have a lot of time to conclude this panel, but I would like to pass you the floor so you can talk about this. An example you can give us, a positive example in terms of technology at the service of healthcare, and what guidelines you can leave so that we think about technology as an ally, not overlooking the other side. So I will talk about technology as an alliance, and as the head of the Doctors Association said about literacy. Although we're not talking about that literacy, digital literacy, but there is a combination of these two fields. For instance, on the 7th of April, World Health Day, we launched a portal, a website, to contribute to greater literacy in health, mental health. It is called Eu Sinto-me, I Feel. And it is basically a huge resource center that is quite simplified with virtual assistant, so that you can go over there and you say, I feel this and that. And there can be some idea given on information that can be useful at that time. And maybe there can be some referrals made that perhaps you should call. And let's bridge to what I've been noting as having been very positive amid this tragedy that was the pandemic, which is the creation of psychological support in the SNS 24 health line. The number of people that have called the line reflects this. We're talking about 80,000 at this moment in just over a year. And it was a door that opened up to an area with a lot of obstacles. And it was a door that was opened referring to those indicators that Miguel said, leveling out the different people in the different areas of the country, showing that the stigma of mental health isn't that serious. If we give people access to the services, they will go there, but they need that. They need it. They need to be able to access these services. But we still need to improve the barriers that we have. There was an aspect here that has to do with data for psychologists, and we're not the only ones. Some of the data necessary aren't yet available to make it easier for us to have better outcomes in this type of work that we're doing, but also referrals which we can't do yet. So people who, beyond that short assistance would need to be referred to a medical center. Perhaps what we can say is, look, there's a website and there's this phone number, call. And the professional who is there knows how difficult it is and how many months it will take until the person can actually have an appointment. So this was very positive nonetheless. And what we've been doing to support it, as well as the shared services. So in the first months we implemented and measured this, we worked with professionals right from the first moment with guidelines for health practices, recommendations for the work that needs to be done in remote interventions, how to set up other support lines, even at a local level, and how to do so. We did this training. We had these recommendations. And on the one hand, having all these recommendations and the guidelines, the technical scientific guidelines with the partnerships, with the shared services and the use of these different technologies mean that in the future, we will have better examples to be able to offer beyond promoting literacy or more and better access to services in this area you referred to. Thank you very much. Before moving to the future, let's stick to the present. Rui Silva will conclude this with you. Nutritionist Association, good examples of what technology has enabled us to do in your field. So before moving on to the good examples, what do we need for them to work? This issue of remote consultations or online consultations, they don't have a legal framework in the National Health Service, so that was quite a huge barrier for us to be able to introduce in such a short period of time these consultations so that people wouldn't lose out on this service. The facilities that National Health Service has available at this moment is also lacking. But for nutritionists, we also need to think that we have about 430 nutritionists in the NHS, and the others operate in private practice. So the access to that data is extremely important, and it doesn't exist. If someone is being monitored in the NHS and goes to a private practice, which is where we have the most, they need to restart their process, their file, because the professional who will be dealing with them won't have access to the medical records. Good examples, the needs that our members felt the association created services. We had 0.3% of people working from home, so people who were not in their place. And during the pandemic, 35% were working from home, plus 17%, give or take, in a hybrid system. These are the good examples. The possibility of this, of having this remote monitoring. If we think about these 400-odd nutritionists spread out throughout the country, there are many areas of the country that don't have access to nutritionists in the NHS. And this allows people who don't have a nutritionist available in their local healthcare center, that's a lot of them, to have access. Nutritionists will no longer then be seen by the privileged few. It's not about aesthetics, it's about health. And a lot of people now feel that nutrition is health, but there is still this inequality. So it is a good example to allow the professionals of the private practices, with all the security that medical data require, obviously, they need having access to those data to promote better service. And I think that is good practice. Access to data. Thank you all. We have now run out of time. We have so many other subjects for other panels. Thank you very much for your participation on the role of professional associations in digital transformation. Thank you very much, and continue your good work.